the word antisocial, they often think of someone who's shy, quiet, or prefers to be alone. But in psychology, antisocial personality disorder means something very different and far more complex. Today, we're breaking down everything you need to know about antisocial personality disorder, or ASPD, what it really means, how it develops, how it affects behavior and relationships, and why understanding it can help reduce stigma and promote awareness. Section 1. What antisocial personality disorder actually is. Antisocial personality disorder is a mental health condition that affects how a person thinks, feels, and behaves toward others. It's defined by a persistent pattern of disregarding or violating the rights of others, often beginning in childhood or adolescence and continuing into adulthood. People with ASPD may break rules, manipulate others, or act impulsively, often without feeling guilt or remorse. But here's what's important to understand. It's not simply about being evil or bad. ASPD is a disorder of personality and empathy regulation, rooted in a combination of biological, environmental, and social factors. Section 2. Common misconceptions. Before going further, let's clear up a few common myths. ASPD does not mean someone avoids social interaction. That's social anxiety or introversion. Not everyone with ASPD is a criminal or violent, and not all people who commit crimes have ASPD. The media often confuses ASPD with terms like sociopath or psychopath. While these words are sometimes used interchangeably, they're not official clinical diagnoses. In psychiatry, ASPD is the term recognized by the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. Section 3. The core symptoms and traits. To meet the criteria for antisocial personality disorder, a person must show a consistent pattern of behaviors, such as repeatedly breaking laws or social norms, deceitfulness or manipulation for personal gain or pleasure, impulsivity or failure to plan ahead, aggressiveness or irritability, reckless disregard for the safety of self or others, consistent irresponsibility, such as failing to sustain work or financial commitments, lack of remorse, even after hurting or exploiting others. These behaviors usually begin before the age of 15, often showing up as conduct disorder in childhood. Things like aggression, property destruction, lying, or truancy. By adulthood, these patterns become more fixed, forming the foundation of ASPD. Section 4. The psychology behind ASPD. At its core, ASPD involves difficulties with empathy, impulse control, and moral reasoning. Brain studies show differences in areas like the amygdala and prefrontal cortex, which are responsible for emotional regulation, fear response, and decision-making. In simpler terms, people with ASPD may not process fear, guilt, or empathy in the same way others do. This doesn't excuse harmful behavior, but it helps us understand that these differences are neurological and developmental, not purely moral. Environmental factors play a huge role too, such as childhood abuse or neglect, unstable or violent home environments, growing up around crime or substance use, lack of positive role models. In many cases, trauma and learned survival behaviors intertwine with genetic predisposition, creating the personality traits associated with ASPD. Section 5. The spectrum of ASPD. It's important to know that ASPD exists on a spectrum. Some people may have mild traits, like being manipulative or callous, without engaging in criminal behavior. Others may display extreme patterns that lead to repeated conflict with the law. Those often labeled as psychopaths or sociopaths usually fall within this same spectrum. Sociopathy tends to describe people shaped primarily by environmental trauma and instability. Psychopathy is often seen as having stronger biological or neurological roots, with a calm, calculating nature. Again, both of these fall under the broader clinical umbrella of antisocial personality disorder. Section 6. Diagnosis and assessment. Diagnosing ASPD isn't simple. Mental health professionals use a combination of interviews, history, and behavioral observations. The diagnosis can only be made in individuals 18 years or older, but symptoms must trace back to behaviors before age 15. Clinicians often look for overlapping signs of other disorders too, such as substance use, ADHD, or borderline personality traits, since these can influence behavior and emotional control. Because denial and manipulation can be part of the disorder itself, diagnosis requires careful, long-term evaluation rather than a single meeting or test. Section 7. Treatment and Management. ASPD is one of the more challenging personality disorders to treat, but improvement is possible, especially when the person is motivated or under structured guidance. Effective approaches include cognitive behavioral therapy, CBT, helps individuals recognize harmful patterns and develop healthier ways of thinking. Schema therapy focuses on changing deep-rooted beliefs formed in childhood. Anger management and impulse control training, useful for managing emotional triggers. Medication. While there's no drug that cures ASPD, antidepressants or mood stabilizers can help manage related symptoms like irritability or aggression. Change usually takes time and commitment, but with support and accountability, individuals can build better self-awareness and control. Section 8. Impact on relationships. People with antisocial personality disorder often struggle to form genuine emotional connections. Relationships can be marked by charm, manipulation, or emotional distance, followed by cycles of control or deceit. That said, not everyone with ASPD is incapable of forming attachments. Some do, but in limited or self-serving ways. Family, friends, or partners may experience confusion, frustration, or betrayal, not realizing these behaviors stem from a deeper disorder. For loved ones, boundaries are essential. It's okay to care about someone, but it's also okay and necessary to protect your own emotional well-being. Section 9. The importance of understanding, not excusing. Understanding. ASPD doesn't mean excusing harmful behavior. Accountability is still crucial, but awareness allows society to move away from pure punishment and toward prevention and rehabilitation. Early intervention, especially during childhood conduct issues, can make a significant difference. Therapy, structure, and positive role modeling can reduce the risk of antisocial patterns solidifying into adulthood. When we view antisocial personality disorder through a lens of understanding instead of fear, we open doors for education, empathy, and better outcomes for individuals and communities alike. Section 10. Final message. Antisocial personality disorder is often painted as cold and inhuman, but beneath that diagnosis are complex stories, often rooted in pain, neglect, and disconnection. It's not about labeling people as monsters, it's about recognizing how trauma, environment, and biology can shape behavior, and how early understanding can lead to healing and prevention. For those living with or affected by ASPD, there is hope in awareness and strength in accountability. The more we learn, the less we fear, and the more we can build a society that sees beyond the label. If this video helped you understand antisocial personality disorder more clearly, consider sharing it. Awareness saves understanding. And remember to subscribe for more calm, educational breakdowns of mental health and personality topics. You never know whose perspective it might change.